Alright, welcome. We're going to talk about how to check a blood pressure today. So the first thing you want to check is that you have all your equipment assembled correctly. If you have a new blood pressure cuff, you may need to attach the gauge and the bulb to the ends of these tubes that are built into the blood pressure cuff. The next thing you can do is most blood pressure cuffs have a little loop here, and on the back of your gauge you do have a little clasp. So you can use that clasp to hook onto the loop, and that way your gauge is attached and you don't have too many pieces to hold. The other thing you want to check is your stethoscope. The earpieces do rotate, so they can rotate. They can either face each other directly, or they can push forward, or they can push backwards. One thing to keep in mind is that our ears, the holes actually go towards the front of our face. So if you have a brand new stethoscope and the earpieces are pointed directly at each other, they rotate here, and we want to kind of push them maybe 30 degrees forward so that when I put these in my ears, they're going to be facing forward. Other than that, once your equipment's assembled, one thing to keep in mind, you never want to inflate the cuff without it being on someone's arm. If you do that, it can rupture the bladder. Alright, so we're ready to check Brandon's blood pressure here. The first thing I'm going to do is get the cuff situated correctly. I'm going to be checking the blood pressure on his right arm. So usually your blood pressure cuff will have some arrows that will tell you right arm or left arm. And then we want this arrow to be pointing at the artery. So if you sort of hyperextend your arm, you probably might not be able to see it on the video, but typically you can see a small blue vein medial on the arm. So not right in the middle, but more towards his trunk. So over on this side, you'll see a blue vein, and that artery is going to be right next to there. And that's where we want that arrow to be pointing. The other thing about the blood pressure cuff is we basically want it centered between his elbow and his armpit. So it doesn't necessarily need to be down in the crease of the elbow, but somewhere in the center. So I'm going to line up that arrow with his blue vein, and cuff on this way. Should have gotten the large cuff out for him, but I think this one will work okay. Okay, now I'm going to put my stethoscope on, remembering that I want the earpieces pointed forward. And now I will place my stethoscope right on the spot where I pointed out to that vein earlier. Okay. So at this point, I'm ready to start inflating the cuff. We're going to inflate the cuff to 200. At that time, I will not be able to hear anything, and I will start to let the air out. So I'm inflating the cuff up to 200. Okay, now I'll slowly let the air out, and I'm listening for a heartbeat. Still don't hear anything. Okay, I just heard the first heartbeat, and I'm still listening, still beating. Okay. So I heard the first heartbeat at about 138 and the last heartbeat at 98. So his blood pressure is measuring 138 over 98. That may be a little high for an adult, but probably not unusual given that we're on camera and I'm using a cuff that's not the perfect size for his arm. One thing to take note of is that as you watch the needle drop, you want to make sure that you're listening for the heartbeat and not looking for the needle to bounce. Sometimes the needle bounces, but that's not the measurement you want to take. So the first heartbeat you hear, you're going to look at the gauge. Wherever the needle's pointing, that's your systolic blood pressure. You'll continue to hear the heartbeat. Once you hear the last heartbeat, you're going to look at your gauge, and wherever the needle's pointing, that's your diastolic blood pressure. And that's how you check a blood pressure by auscultation. Okay, so as you measure a blood pressure, one of the hardest things is to let the needle fall at the appropriate speed. So I'm going to demonstrate here how quickly you want that needle to fall. That speed right there is about perfect. So it's falling slow enough that you can still hear the heartbeats, but it's going fast enough that your patient is not increasingly going into too much pain. Once you've heard that last heartbeat, we'll say his last heartbeat I just heard right there, you want to open the gauge all the way to relieve the pressure. Now let me show you once how you would do it wrong. Twice actually. So you could go way too fast. That's way too fast. You wouldn't be able to hear the heartbeats effectively. And here's once that's way too slow. Okay. If the needle's moving at that pace, that's too slow right there. See how the needle's still falling, but my patient would be getting in more and more pain as this goes and would likely have an incorrect blood pressure reading. So we really want that needle to just fall steadily, sort of like that.